Hey everybody, my name is Rebecca Strafe. I'm a nurse in the Mississippi University program for the Bachelor Nurses. I'm going to be doing a presentation today on antibiotic resistance. Antibiotic resistance, when do antibiotics work? Some objectives. By the end of this presentation, the audience will be able to distinguish the difference in bacterial and viral illnesses, be informed of the proper use of antibiotics, be informed of antibiotic resistance and the causes of it, and be informed of their individual responsibility to do their part in preventing antibiotic resistance. So what makes us sick? Bacterial infections are caused by bacteria that invade our bodies and can be treated with antibiotics. Viral infections are caused by viruses that invade our bodies and are not affected by the use of antibiotics. Bacteria are single-celled organisms found all over the inside and outside of our bodies. Bacteria is not always harmful. It can actually be helpful in certain areas, especially in the gut. When the bacteria turn into infections, they are treated with antibiotics. Viruses are microbes that are smaller than bacteria and cannot survive outside the cell. They cause illnesses by invading cells. They are not affected by the treatment of antibiotics. Some infections caused by bacteria are strep throat, tuberculosis, urinary tract infections, and these are just to name a few. These are examples of bacterial infections. Some signs of infection are redness, pus, and fever. You can see these on tonsils or wounds that are infected. Bacteria can invade your bladder, giving you a bladder infection as well. Some viral infections are the common cold, influenza, and respiratory syncytial virus, also known as RSV. Viral infections will need to run their course. These infections sometimes have medications called antiviral medications that can shorten the length of the virus by preventing the virus from reproducing in the body. There are also some vaccines for certain viral infections. People with viral infections can take medications such as Tylenol or ibuprofen for pain and fever, and be sure to drink plenty of fluids to prohibit becoming dehydrated. If symptoms continue to worsen, consult your doctor or go to your local emergency room. Bacterial or viral infections. These can include middle ear infections, sinus infections, and bronchitis. Sometimes you can be sick and unsure of the cause. These illnesses can be viral or bacterial. That's why when you go to the doctor, they may draw your blood to check a white blood cell count. Your white blood cells increase when your body has a bacterial infection. A high white count can usually means you need an antibiotic. This is where I had a video I was going to show you all about antibiotic resistance, but I can't get it to work, so we're just going to skip past it. What are antibiotics? Antibiotics fight infection caused by bacteria. They kill bacteria or make it difficult to grow and multiply. They are also known as antimicrobials. Antibiotics can be given by mouth or through your IV. And antibiotic administration is dependent on the extent of the infection. If you are admitted into the hospital for pneumonia, it is usually so that you can have IV antibiotics. Cultures of the blood or wound are obtained to see which antibiotic will work best against a certain bacteria that is attacking the body. It is important to have the correct antibiotic when treating a patient. Some do's about antibiotics. Only take the antibiotics when they're prescribed by your doctor. Take your antibiotic exactly how your doctor tells you to do, and safely discard any leftover medications. Some things you should be aware of. Do not borrow your neighbor's medication when you're sick. Do not stop taking your antibiotic when you start to feel better. This simply means that the medication is working. If you do not finish the round, the infection will come back bigger and stronger. Some don'ts for antibiotics. Do not take an antibiotic for viral infections. Never pressure your healthcare provider for antibiotics for your child or yourself. Never save antibiotics to take at a later date. This is important, especially for all the people that grew up with a bottle of pink antibiotic in the refrigerator that you would pull out to take or give your children when they were sick. Never pressure your provider for an antibiotic. I grew up in a time where my doctor would say, I will give you an antibiotic just in case because it won't hurt anything. Times have changed and we know better now. Medicine has changed and gotten a lot better. Antibiotic resistance. This occurs when bacteria change in a way that reduces the effectiveness of drugs or chemicals. It is when the germs are not killed and their growth is not stopped. It makes bacterial infections difficult to treat. It occurs when antibiotics are overused and misused. Every time you take an antibiotic, sensitive bacteria is killed, but resistant bacteria are left to grow and multiply. Bacteria are smart and evolve into stronger bacteria with each antibiotic administration. They can change their structure so that antibiotics cannot stick to them and harm them. Even if one bacterium finds a way to resist the antibiotic, it can multiply and replace all of the bacteria that were killed off. Lots of bacteria live in your gut. When you take an antibiotic, you kill a lot of the healthy bacteria in your gut and can allow harmful bacteria to grow. These resistant bacteria that grow and spread to family members, schoolmates, and co-workers and can threaten an entire community. These become more and more difficult to treat and can lead to disability and even death. So what is your part in this? Tell your healthcare provider you are concerned about antibiotic resistance. Ask your healthcare provider if there are steps you can take to feel better without the use of antibiotics. Update your vaccines as recommended. Never take antibiotics prescribed to someone else. Follow instructions provided by your doctor for the antibiotics prescribed. Thank you so much for coming out to view my presentation today. If y'all have any questions, you can ask me, or you can consult your healthcare provider and ask them more about the situation that we have today in America. Thank you.